Imagine it's 2 a.m. in the emergency room at an animal hospital, and they get a call that a male cat has been unable to urinate and has been vocal all day. By the time the cat arrives at the hospital, his bladder is dangerously full, and dangerous toxins are already building up in his blood. Urinary obstruction in cats can be a fatal condition that can develop rapidly, and all cat owners should understand the risks, causes, and treatments. Today, I'm here to share a few clinical signs, risk factors, complications, and outcome for cats so that all cat owners can be better informed and aware of these potentially fatal issues. The first thing that all cat owners should be aware of is the clinical signs seen before presenting to a veterinarian. Urinary obstruction in cats can present in several ways. Recognizing these clinical signs is vital for helping owners respond to the condition appropriately. Most cats presenting with urinary obstruction have a few-hour history of straining to urinate, frequent trips to the litter box, and vocalization. Beyond the clinical signs, the risk factors can be just as important in understanding. A 2011 study evaluated risk factors that may influence cats even before clinical signs appear. One of the greatest risk factors discussed in veterinary medicine has been evaluating stressors in the home prior to the condition. A study by Defoe found that new stressors in the home do not necessarily have a major impact on urinary obstruction, except for moving to a new home completely. Some of these idiopathic factors of feline urinary lower tract disease can be geographical factors. A 2017 study by Sumner and Rinchi found that cats residing on the northeastern coast of the United States showed a higher peak in UOs during the spring months of April and May. Once understanding these risk factors, we can evaluate some of the treatments. A study by Nivi evaluated the use of low-dose meloxicam, a non-steroidal anti-inflammatory drug, in cats with UO. For years, various veterinarians have used meloxicam for urinary obstruction, believing it would help reoccurrence. A study published by Nivi in 2019 found no clinical benefit from meloxicam, showing that treatments and diagnostics are ever changing, as with the rest of the veterinary field of medicine. Now, understanding some of the clinical signs, the risks, and treatments, we can look at some treatment complications. Some things to consider for your own cat if they unfortunately have to experience this are post-unblocking complications. A study performed by Garganzio found that some of these cats develop issues after catheterization. When catheterization is performed to unblock the cat, we may have an increased need for perianal urethrostomy due to our stricture of the catheter placement. We can also see increased complications post-PU procedure. A study published by the Journal of Feline Medicine and Surgery found that 31.8% of cats have recurrent complications like urinary tract infection and scalding issues around the PU site. Even with the possible complications, it is important for cat owners to see and understand when making decisions for their individual pets. From understanding the clinical signs on presentation, the possible risks, factors, and now complications during treatment of a urinary obstruction, these are all important things for all cat owners to understand. Cat owners can take the appropriate steps in understanding what a urinary obstruction looks like and what treatments and complications look like. What may look like a small litter box issue can actually be a life-threatening medical emergency. Understanding that difference can make all the difference.